Hello, everybody, and welcome to O2 Classroom. I'm Lisa, and I'm the producer of O2 Classroom and also the educational content developer here at First Class Medical. We're here every Tuesday to talk about different topics about how to better manage your respiratory condition. Last week we talked a little bit about disaster preparedness because of the hurricanes on the East Coast and the fires on the West Coast, and some strategies that could help you be prepared for those. Hopefully you're not dealing with that right now, but if you are, we hope those helped. If you have any questions about that or anything else, just put them here in the comments. I'll answer them live if I can. Even if you're not watching this live, go ahead and put them there, because I'll look through the comments throughout the week and try to get them answered either from myself or one of the respiratory specialists that we are in contact with, respiratory therapists or anything like that. So let us know. Thanks for watching, and let me know if you have any questions. Today, we are going to talk about a comorbidity. A comorbidity just means a condition that exists in conjunction with, sometimes because of, and not necessarily, a lung condition. So today, we're going to talk about heart conditions and COPD. One of the reasons why these are such common comorbidities is that they have similar symptoms. One of the biggest symptoms of both lung disease and heart failure is shortness of breath. And they also have one common cause. There's different causes for each, but the one common cause that is, a high level for both is smoking. So if you haven't quit smoking already, please do so. Thrive has a free quit smoking program. I'll put the link here. Michelle, if you're watching, I know you, I think, signed up for that program. So let me know how that went for you. And if you have any questions, Michelle quit smoking. So let's give her some support, some love, show her some love for that, because that's awesome. And it's not easy, but it's necessary if you're serious about your respiratory or your pulmonary health. Okay. So as I said, if you have COPD or you have heart failure or some heart condition, one of the symptoms that you might experience is shortness of breath, but it's for two different reasons. The first one is if you have COPD, we talk all the time about lung elasticity. And the reason why you feel short of breath when you have COPD is that not necessarily that you're not getting enough air in. It's just that you're retaining CO2 because your lungs aren't elastic enough to push that out as you exhale. So it's maintaining some of that CO2. So you can't take enough fresh air in, and it's just maintaining some of that CO2. So you'll feel out of breath. Heart failure, you feel out of breath for a different reason. Somebody asked last week about sometimes their pulse ox readings are fine, but they still feel short of breath. And then we sort of explained how pulse ox readings don't necessarily equate to shortness of breath, because even if you have plenty of oxygen in your lungs, your heart isn't moving that oxygen throughout your body. And so your body's going into that fight or flight, which is trying to pump more and more blood, because it's saying, hey, the brain needs oxygen, the heart needs oxygen, or something like that. So it's just trying to pump it more. So you're likely to feel short of breath because of that. We have a video that explains all that. I'll put the link here too. It goes through the whole thing and explains it very well. So I'll do that. So if you have heart failure and that fluid's backing up into your lungs, that fluid congestion throughout your body, especially in your lungs, causes shortness of breath. We've talked before about edema, which is basically fluid buildup, and it's usually in your extremities. And generally sometimes you see it in your hands, but mostly you'll see it because of gravity in your legs. Your ankles will swell with fluid, and that also affects your breathing. It makes your breathing harder. And that is a sign that your heart isn't working properly. So something definitely to talk to your doctor about if you experience that often. And we have a whole show about edema too, so you can go back and watch that if you want to. If you want to watch that show or any of the other shows that we've done, go to First Class Medical's Facebook page. Up at the top, you'll see a drop-down menu that says More. Click on More. You'll see one of those choices is videos. You'll see myself or Corey, who's one of the owners here, talking about any number of topics. And if you have a question that doesn't get answered by one of those videos, put it here in the comments, because we'll make sure we do a video about it, because you're probably not the only one wondering about it. Okay, so you can go back and watch the edema show if it's something. First of all, talk to your doctor, but it's also something that we talked about as far as how you can help it: movement, diet, things like that. Okay, COPD weakens your lungs, as we talked about, and causes a drop in oxygen level. And which means that your heart and other organs throughout your body aren't getting enough oxygen all the time. So weak lungs can also cause pulmonary hypertension, more commonly known as high blood pressure, because your body is trying to push that blood through and it's causing, more pressure to build up. And the major blood vessels that carry blood from the right side of the heart to the lungs, where it's oxygenated, and arteries can become narrow and stiff, causing the pressure to rise up. And that puts stress on the right side of your heart. So there's two, you're right, your heart has two sides, as you probably know, the right and the left side. The right side of the heart in your circulatory system. So the right side of your heart receives oxygen poor blood. So after the blood's gone through the body and delivered oxygen to your kidneys, everywhere else where it needs to go, it goes back into your heart where it picks up, where it's going to pick up more oxygen, gets rid of carbon dioxide. The left side of the heart receives oxygen-rich blood from your lungs and pumps it through your arteries throughout the rest of your body. So when it's going out, that's where it goes, the left side. So oftentimes, because COPD is not doing a good job of oxygenating that blood fully, it's maintaining too much CO2 and not putting enough pure oxygen in that blood, it can cause some left side heart failure. And again, that causes high blood pressure or sometimes coronary artery disease because the arteries are getting blocked up or stiffening. And they influence each other. They're not necessarily the cause of one another, but they do influence one another. So low oxygen in the blood can put your strain in your heart, which worsens the left side of your heart and can cause that to fail. And too much fluid in the lungs from heart failure can make your breathing even harder. You got fluid built up there, it's going to make it even harder to breathe. So when you've moved on and your conditions progressed and you have severe COPD, that's when you might experience some right side heart failure. And so it's mainly like in the lower right chamber of your heart. It causes fluid to build up in your body. It's the edema that we talked about. And that causes that side of the heart to work harder than it should and possibly, lead to heart failure. So if you're experiencing any of these things and you suspect that your heart might be being affected by your COPD, what you're going to go to your doctor and what might happen. So there's a few different things, different ways that they'll diagnose your heart condition. First of all, just regular physical examination. They'll listen to your lungs, your heart. They'll look at the veins. They have, a device that they can look through your veins with just, it's not exploratory surgery or anything. It's just like it's like an ultrasound where they can watch the veins in your neck and see how the blood is flowing. So they'll probably start with that. If they suspect that something's wrong, you'll probably have to go through a chest x-ray. And, they'll look in there and see if in your chest x-ray, they see a lot of fluid building up in there. And, in the x-ray, they'll see it. And in COPD, your lungs usually look clear, or they may look like they're overinflated. But if they also look darker, like they're retaining fluid, that's a sign that you might have some heart things going on. Another thing is if you have COPD, if you've been diagnosed with COPD, likely you've gone through a pulmonary function test, breathing tests, where they have you walk on a treadmill and, do tests like that just to make sure how your breathing changes as you get active. They might also give you an echocardiogram, which is an ultrasound test of your heart, which looks through those chambers that we talked about and looks at the valves and if they're opening, closing the way that they should, and what is the pumping strength as it's, pumping blood throughout your circulatory system. Another thing they might do is give you a blood test. And the reason they'll give you a blood test is that they are going to check for your cardiac enzymes. There's an enzyme that we all have in our body called troponin. And normally the levels of troponin are so low in your body that they're undetectable by a test. So if they give you a cardiac enzyme blood test and they detect levels of troponin, it's likely that you have had a heart attack or you have had some sort of heart injury. Your heart's not functioning properly. And, people say, well, why do I need to know if I've had a heart attack? I would know that, but you don't always know. My aunt, as a matter of fact, she had some health problems later in her life. And when she went to the doctor, he said, when did you have a heart attack? And she said, I didn't have a heart attack. And he said, oh, yes, you did. When they looked at her heart, it showed, extensive damage. And she just, even looking back, she worked all the way up until she was in her 70s and things like that. Never, thought that she had a heart attack. She was surprised. As a matter of fact, she didn't believe him, and she also went to another doctor to get a second opinion. And sure enough, she had a heart attack. So I know it sounds strange, but it's possible that you might not know. Okay, so that's what, if you go to the doctor, they'll advise you as far as what medications you might need to get on or anything like that. Other ways to improve your heart health as well as your lung condition. First of all, what we've already talked about, please quit smoking. It's a leading cause of not only COPD, but also coronary artery disease. So quit smoking and stay away from secondhand smoke. See your doctor and follow the directions, follow their prescription regimen, take the pills, get on the oxygen, whatever they tell you to do. It's maintaining not only your symptoms as far as shortness of breath, but it's also maintaining the health of all your all your organs, including your heart, your brain, everything. Keep track of your cholesterol and your blood pressure. Those numbers are easy to get at any doctor's office. I mean, I know during COVID, they actually shut down. I used to go to CVS pharmacy not too far from me, and every now and again I'd take my blood pressure just to make sure everything was all right. And I know during COVID they shut those things down, but hopefully, I don't know, they'll be opening up pretty soon. But make sure that you're doing, if your doctor says check every 6 months, 3 months, do whatever they tell you to do, and make sure that you know your cholesterol numbers as well. Manage your weight. Eat a heart healthy diet that's rich in fruits, vegetables, all the natural foods we talk about, whole grains. Whole grains are complex carbohydrates. We talk all the time on this show about the respiratory quotient and how different foods create different levels of CO2 in your body. So different foods are going to make your breathing harder or easier as we go along. So carbohydrates create the most CO2 for the most energy produced. Energy produced from food is measured in calories. So for the calories that you gain, simple carbohydrates produce the most CO2. So you're getting the least benefit, whereas healthy fats produce the least. So we have a show about that as well. If you have any questions about that, let me know. I can put the links in here for you. So yep, fruits, vegetables, whole grains, and also healthy fats and low in sugar. Stay active. I know sometimes it's scary to get out and be active, because you think, if I get out of breath, then I'm going to have an exacerbation, or I'm going to be somewhere and I'm going to trigger some sort of, negative lung reaction, which I know is scary. However, decreasing your activity levels is going to do just the opposite. You need to maintain that aerobic health, and you need to maintain your muscle tone. Breathing is, a muscle function. Your lungs don't do anything on their own. They act like bellows. And it's your diaphragm and your intercostal muscles that squeeze that together. So you got to work on keeping those muscles healthy, even if your lungs are scarred or they're damaged in some way. By maintaining those muscles, you're actually going to improve your breathing. And actually, you can improve breathing. You can't heal that damaged tissue we always talked about, but you can improve the things that work your lungs that are going to make your breathing that much easier. We talk on the show all the time. We're try to be very solution based. And so we talk a lot about dietary functions, dietary things. One of the things that is good for both your lungs and for your heart is vitamin D, also known as the sunshine vitamin. There's a good free source of vitamin D up in the sky, sunshine. And CHEST, which is the American College of Chest Physicians, that's their journal, linked vitamin D deficiency to worsening lung function and increased risk of exacerbation. But like I said, it's good for your heart as well. There's another study from Johns Hopkins that found that vitamin D deficiency is also linked to increased risk of cardiovascular disease. Okay, Michelle says she's losing weight, great, and staying away from dairy products. Ensure his milk protein, and I need some help with this problem, please. Okay, some people have a sensitivity to dairy. Some people can drink dairy and it's just fine. It's a good source of vitamin D. It's good for calcium. It's good for your lungs, things like that. But some people, It causes, you either have stomach problems, it causes some bloating and you have some stomach issues there, or some people find that it increases mucus production or thickens their mucus. It doesn't happen to everybody. It's just if you have sensitivity. So if you don't have, doesn't affect you that way, great. It's a good source. If you don't have it, you're going to have to find some things that, if you want milk or you need to cook with milk, you might try soy milk, you might try almond milk. We talk on the show all the time also about keeping a food diary. And you think, that sounds like a pain. Well, it could be. However, that little bit of food detective work early on in your condition is going to help you so much as you go along. Because if you know what foods trigger breathing problems, or what foods make you feel bloated so that you can't breathe, or what foods maybe you have like a slight allergy to or something like that, you can either avoid those foods, you can eat smaller quantities, you can prepare them differently. You can eat them different times a day. Sometimes, if you eat a food, something spicy, later in the day, and it's, maybe 3 or 4 hours before bedtime, and you lay down, it might give you heartburn, but it might be something that if you eat for lunch, eat at 11 o'clock and you're moving throughout the day and your digestion's aided by, movement and gravity, it might be just fine. But in order to know that, you're going to have to keep a written journal. Those of you who've been through the Thrive program know all about the food diary. It's a free download. You can, it shows you how to keep notes of everything. And it's also a good thing that if you are going to talk to a dietitian, or you can take to your doctor and show them, this is what's affecting me, and they might be able to give you some more advice too. If you just tell the doctor sometimes in the afternoon you feel bad, he doesn't know if it's because you didn't sleep well. He didn't know if it's because you ate what you ate, you ate too much, anything like that. So the more information that you can give the doctor when you go visit him or her, the more that they'll be able to help you, and the more that you're going to be able to manage your own condition better. Knowledge is power. So make sure to keep that food diary. Okay. One of the things that is very important, and it's one of the best preventative measures that you can have for preventing heart disease, but it's also good for your lung health as well. We did a show several months ago talking about your gut biome. Hippocrates, thousands of years ago, said that your immune system mostly, lives in your gut. And they found, even though he said that all that time ago, it has been found to be true. So you want to make sure that you're keeping that biome in there, which by biome, I mean the healthy bacteria and the fungus down, and different kinds of things that help your digestion, the flora and fauna of your stomach healthy. And fiber is good for that. There are two kinds of fiber: soluble fiber and insoluble fiber. So soluble fiber it kind of soft and sticky. It absorbs water and forms kind of a gel. It helps your digestion. Something that turns into soluble fiber is oats, barley, beans, apples, citrus fruits, and carrots. And soluble fiber also help with your cholesterol. It binds to cholesterol and sugars, and it prevents absorption. From the digestive tract. And it also helps reduce cholesterol. It reduces the LDL, which is, there's a good cholesterol and bad cholesterol. It reduces the LDL, which is the bad cholesterol, and it doesn't affect the good cholesterol at all. That's soluble fiber. Insoluble fiber is what we sometimes call roughage. It's those vegetables that kind of help if you are if you're constipated or something like that. Roughage is one of those things that you probably don't want to eat later in the day. It's probably something that might cause bloating if you are mostly sedentary. Have a good salad or something earlier in the day while you're still moving around, because it helps the digestion, helps clean out that digestive tract. But it's also something that can make you feel kind of bloated and miserable if you eat it and then sit around and then try to go to bed. So roughage, it adds bulk basically to your body's waste and helps clean it out. Things like whole grains, nuts, fruits, and vegetables are all roughage, including the best things for that are wheat bran, nuts, veggies, especially cauliflower, green beans, and potatoes. So that's good roughage right there. So a study of dietary fiber reduces the risk of coronary heart disease by improving blood lipid profiles that we talked about, lowers your blood pressure, and improves insulin sensitivity. So those of you who are struggling with blood sugar issues, fiber is good for that as well. It also reduces inflammation. As we know, COPD is an inflammatory disease, so anything that has anti-inflammatory properties is going to be positive for you. It also helps maintain healthy body weight and is often rich in antioxidants, so keeps your immune system healthy, gives your immune system a boost. And make sure you choose whole grains, fruits, and as I said, that kind of thing you might want to stick to a morning or early afternoon meal and avoid those things at night, just to help your digestion and make sure that you can sleep comfortably and everything. Okay. Omega-3 fatty acids we've talked a lot about because they are great for anti-inflammatories, but they're also good for heart health. They prevent blood clotting. So if you're on blood thinners and you eat some foods that have omega-3 fatty acids, they should help that out as well. It also lowers LDL, the bad cholesterol, and it also has a positive effect on the heart's rhythm. Omega-3 can't be made in the body. So it's something that you have to get from your diet. So fatty fish, salmon, tuna, all those things have omega-3 fatty acids. You can also take supplements. We've talked a lot about that on the show. If there's something that you can't eat, there's a dietary thing that you're sensitive to and you can't eat it, you found that in your food diary, supplements are fine. However, if you can't eat the food, your body is going to have an easier and better time of absorbing those nutrients from the food versus supplements, just because that's how our bodies are designed. So if you can get it from, fatty fish, like I said, salmon, tuna, you can also get it in vegetable oils, walnuts, flax seeds, and leafy vegetables as well. Okay, so as I said before, fats are one of the things that causes the least amount of CO2 when digested. But you want to stick to the monounsaturated fats or healthy fats. Those lower LDL cholesterol and increase the good cholesterol, the HDL. So replace saturated fats and trans fats with monounsaturated fats. It's much, much healthier for cooking. A lighter oil like olive oil or canola oil, peanut oil or safflower oil, or even sesame oil, which I like to cook with. Sesame oil has a nice flavor. It's good on salads as well. And eating nuts like almonds, peanuts, walnuts, avocados, all healthy fats and good for your cholesterol, your heart, as well as your breathing. Okay. Another thing that is good for your heart as well as your lungs is folate. Folate assists in controlling what is called homocysteine. Homocysteine is an amino acid, which they found is linked to the hardening of arteries. So B vitamins and folate lower the levels of homocysteine and help guard against the hardening of artery walls. So the Journal of Clinical Nutrition showed that folic acid lowers the risk of stroke by as much as 12% by lowering homocysteine levels in the blood and reducing arterial wall thickening. So where do you find folate? Again, you can find it in supplements, but spinach, mint, and soy are all good sources of folic acid. Okay, quercetin. We've talked about quercetin a lot on this show as well. The old saying goes, an apple a day keeps the doctor away. And that's true. And one of the reasons is because apples have quercetin in them. Quercetin is an anti-inflammatory, and it's been shown to lower the risk of plaque buildup. So reducing blood pressure and reducing LDL cholesterol. In addition to apples, citrus fruits, onions, parsley, sage, and black tea are all good sources of quercetin. Okay, lycopene. Lycopene is an antioxidant, and that lycopene is what makes tomatoes red. There's been a number of clinical studies that have established that it has a protective role in lowering blood pressure and C-reactive protein. C-reactive protein is a marker for cardiac inflammation, basically. So like anything that has lycopene in it, including tomatoes, is going to be good for lowering that C-reactive protein and lowering cardiac inflammation. Magnesium is another thing we've talked about a lot on here, especially when we talked about bone health. Magnesium is good for bones. It's good for, there's hardly a function that happens in your body that magnesium doesn't participate somehow. It's necessary for more than 300 biochemical reactions in the body, they found. It helps maintain nerve and muscle function. It keeps the heart rhythm steady. It maintains blood pressure, among many other things. And magnesium is also associated with to lower risk of cardiovascular disease. And also, we talk about if you're on corticosteroids, that can sometimes be detrimental to your bones. Magnesium is good because it helps with calcium absorption as well. So it's good on many levels. Whole grains, black beans, soy and tofu, almonds, pumpkin seeds, and spinach are all really good sources of magnesium. And the last thing that we're going to talk about is plant sterols and plant stanols. Basically, phytosterols, they're naturally occurring plant compounds that they actually resemble the structure of cholesterol. So when you eat them and they're digested, they actually compete with cholesterol, and that limits the amount of actual cholesterol that can be absorbed in your body. The National Cholesterol Education Program found that eating 2 to 3 grams of polysterols will reduce LDL cholesterol, the bad cholesterol, by up to 6 to 15%. That's 2 to 3 grams per day. Wheat germ, wheat bran, peanuts, vegetable oils such as corn, canola, and olive oil, and almonds and Brussels sprouts are all really good sources of phytosterols. Okay, so heart health and lung health. Keep in mind that they are both interrelated. And if you see any, just because you're I think it's good that everybody has a pulse ox. However, that's not necessarily the whole picture of your heart and lung health. So if you start feeling out of sorts, or you're retaining fluids, and you take your pulse ox and you think, well, my pulse ox is at 95, must be all right. Please don't do that. If you have any other symptoms such as retaining fluid, you're feeling shortness of breath, it's something that you should be talking to your doctor about, because it could be, maybe it's not your oxygen saturation. Could be also that your heart isn't functioning properly, and it's not pushing that blood throughout your system as well. So if you suspect that you have any of these issues, please talk to your doctor. It's important. Along with lung tissue, any kind of heart tissue that gets damaged, it really can't be repaired without, there's surgeries and things like that can be done. But if you can stop the damage as it's happening, prevent further damage, that's the best way to go. Okay, Tanya is asking, what can you do to have more energy? Okay, so we did a whole show on this. I'm going to put the link on that as well. However, I'll talk for a few minutes about that. So there's definitely a few different things that cause you to have low energy if you have COPD or any kind of lung condition. One of them is that you're maintaining CO2, and that CO2 in your body is causing you to feel a little groggy, a little, it zaps that energy. So doing active cycle breathing first thing in the morning and several times throughout the day is going to help to expel that CO2. Active cycle breathing is a combination of three different breathing techniques. The first one is pursed lip breathing, where you are going to take in however much you can take in. If you can take in it for a count of 4, and then you're going to exhale for twice the amount of time. So you're not going to be stacking those breaths by taking in more and more. You're going to exhale for as long as you can, blow, blow, blow as hard as you can to get that CO2 out. And why does breathing through pursed lips make a difference versus just breathing or through your nose? Is because you're causing, by pursing your lips and making that opening a little bit smaller, you're causing some backup pressure that's going to force that air out more fully. It's the same principle. I've said this before of, if you are using a hose and you need to squirt something and you're not quite getting it far out, so you put your thumb down over the opening of the hose and it causes the water to shoot out a little more. It's because when you make the hole smaller, you're causing some backup pressure that's going to make that a little bit further and stronger. And it's the same principle with your breathing. So the first thing you want to do is go through a few rounds of pursed lip breathing. It's where you breathe in for whatever count you can do and then breathe out for twice that amount through pursed lips. Okay, so then once you do that, you're going to want to, and you're feeling that your airways are opening up a little bit, relaxing a little bit, and you're getting some of that CO2 out. Then you're going to go into some deep breathing. And it's just basically just breathe in as deep as you can through your nose. Hold momentarily, and then don't force it out. When you're doing pursed lip breathing, you're blowing out. When you're doing deep breathing, you're just letting it flow out. You're just getting some air in there. Now that your airways are more relaxed, you can hopefully exhale a little bit further. You can go back and do pursed lip breathing. If it didn't feel good and you think, well, I still got some CO2 in there, just go back and do some pursed lip breathing. Calm down. Don't scrunch your shoulders up. Sit up nice and straight. Make sure your chest cavity is nice and open. Do some pursed lip breathing, do some deep breathing. Then if you feel like you've got some congestion there, have some mucus down in there, you can do what is known as huff breathing. So you've done the pursed lip breathing, it's relaxed your airways. You've done some deep breathing, you got some air built up in there. Now you're going to go to huff coughing or huff breathing. Huff breathing is basically you're trying to make some, put some air down there into your lungs, and then you're using some suction to sort of bring some of that congestion up. And when you do it, you're going to make like a noise. And that you'll kind of feel if you're doing it right, you'll sort of feel some tension right here. And that's sort of bringing that mucus up. And it's sort of almost like you're trying to fog up a glass or fog up a mirror like that. And you're making that tension right there. We do have a video where you can follow along on that. I'll put that on here as well. So first thing you can do to have more energy, do some pursed lip breathing. Make sure you're not maintaining some of that CO2. The other thing that you can do is a lot of times people who have COPD or IPF or any kind of breathing exercise, you can use up to, 10, 12 times more calories just in the act of breathing than somebody with normal lung function. So, that's obviously going to make you tired. So doing these breathing exercises and doing these I know it's like, I'm very tired. Like, how can I exercise? Just start from where you're at. Don't try to compare yourself to other people. Try to best your own personal best. And, if you can walk around the living room, great. If tomorrow you can walk out up and down the block once, that's great. Next week you can walk around the block, that's great. Just try to do as best you can. And little by little, you're going to improve that. There's plenty of exercises that are shown online for muscles and things like that. Maintaining muscle tone and muscle balance is going to help you maintain quality of life. Studies have shown that respiratory patients who have the least quality of life, or they've complained the most that their quality of life has deteriorated the most. Yes, partially it is from their lung disease, but a lot of it is because they've lost mobility. And they've done that because their muscles, they're not working those muscles out, and they're not working to get that oxygen into the muscles. Some of, we're sort of maintaining muscle tone, just having healthy lung function. But if you have to work a little bit harder, breathe a little bit harder, and get a little bit more oxygen in and do those breathing exercises, it's going to help your muscles in the long run. The other thing you want to look at is your diet. Are you eating good vegetables, things that are good for energy? Anything that takes a long time to digest might not be so good for you. That's where the food diary comes in. But eating a lot of snacks that are going to give you a energy boost, like nuts, dried fruits, anything like that, versus potato chips, versus unhealthy snacks that are just sort of empty calories or not giving you any sort of energy. Those are going to help too. So, try to eat better. We have tons of nutritional content on this site. both on the videos and also on our blog. You can look through if you want specific, I'll do a show next week specifically all about energy if you like. I'm sure you're not the only person wondering about that, so we'll talk more about that next week. But I'll put the Thrive link on here too. If you don't know how to do the active cycle breathing technique, it's something that is 100% key for managing a respiratory condition. You must do it every day. Do it first thing in the morning, helps clear out the congestion. I don't have to tell you, I'm sure that if you lay down, your chest gets congested in the middle of the night. So if you do that active cycle breathing in the morning, it's going to clear that stuff out. Do it before you eat. Makes eating a little bit easier. Your breathing is going to be optimal as best as it is for you. It's going to make eating and digesting that much easier. Do it before, maybe 10 or 15 minutes before you take your medication. If your airways are relaxed and as open as possible, when you take that inhaled corticosteroid, that medication is going to go down into your lungs as deep as it can. It's not going to just end up here in your throat because your lungs are all congested. It's going to go down in the lungs where it's going to do you some good. So it's 100%. You have to learn it. And because of that, Thrive made that class. They made the active cycle breathing class, the food diary class, and the monitoring symptoms class free, because those are 3 things that you absolutely have to know if you are a lung patient, no matter what stage you're in, no matter if you're on oxygen or not. Those are the 3 things that you absolutely have to know. So I'll put that link here. The intro classes are free. You can just sign up, and they're online. And they're, once you sign up, you can watch them over and over again. You can download the things for free. And, it's something that you need to know. So we'll talk more about energy next week. Thanks for asking that, Tanya. Michelle, thank you for watching, and thanks for your support. And I will talk to you guys next week. Thank you for watching. Take care.